Hello everyone, this is Chadi Alraies from NCVH in New Orleans. I'm really privileged today to be with Dr. Fadi Saab, who is one of the co-directors for NCVH, but also has been an expert in peripheral vascular disease. Dr. Saab, thanks for being with us.
Thank you, Chadi. Thank you for having me on.
Yeah. So as you know, this conference is focused a lot on peripheral vascular disease. So there's a lot of big gap in knowledge for fellows as well as for operators in practice. So tell us how this conference fits in for the practicing physicians.
It's a great question, Chadi. The biggest challenge currently in peripheral arterial disease and critical limb ischemia, on one end, it's an exciting time because there's a lot of new technologies. There is an explosion of new technologies. And what we're able to do today is definitely leaps and bounds of what we were able to do 5 years ago. But that comes at a price. The price being is you have to be up to date on the data, and you have to invest time, effort to learn these technologies, when to apply them, how to apply them, and understand the limitations of some of these new technologies.
Right.
So that's a double-edged sword. It goes to your point that there are people that are not necessarily keeping up to date on some of these new technologies. And venues like NCVH, like AMP, like ISET, these are meetings that are on the cutting edge, that are always discussing the latest and the greatest technologies and how to apply these technologies in this difficult arena.
Right. So you mentioned something very important, to learn new things, but I would like to add one more layer of obstacles or barrier, unfortunately, is how to get them to your lab, especially to the hospital-based labs, where you have to negotiate with administration, and there is different kind of packages and reimbursement models for each health system.
Yeah, that is one of the unfortunate things because on one end, I came from a background where I worked in a hospital environment, and we moved to an outpatient environment. And there's pros and cons to each approach. But the reality, Chadi, is I feel that at the heart of each one of those challenges, there has to be a champion. And typically, usually, it's a physician champion that will champion these approaches.
Yes, yeah.
Having said that, it is very difficult sometimes to navigate because on one end you have someone who's well-intended, but they're looking or measuring things based on certain numbers or certain parameters, and we, the physicians, have to understand how to explain some of these technologies in a way that they understand.
Yeah.
In order to facilitate, bringing these new technologies. Sometimes the investment is not short-term benefit. Sometimes it's long-term benefit. Yeah. You have to wait for it. And they also have to understand that to invest in these new technologies, that means investing in the reputation, the outcomes of that center, and the ability to deliver care either locally or even on a wider regional facilities.
Okay. Yeah. So moving along to your topic at NCVH, I know you're passionate about CLI, about PAD. So what is the things that you're presenting at the NCVH this year?
Every year I tell myself that there is a topic that I would like personally, professionally to focus on. And one of the things that I feel really passionate about is highlighting the gap between randomized controlled trials and real-world practice.
Yes.
And I'm the first one to say that randomized controlled trials are important because the list is a mile long.
Yeah.
But the challenge with randomized controlled trials in a subset of patients that are as sick as CLI population, it really makes it difficult for physicians like you and I to implement the findings of those trials, and more importantly, get the same results that these trials got in that patient population.
Because these patients are handpicked, and oftentimes they're excluded from the trial.
Correct.
GFR of 15.
Correct.
And a CLI.
Correct.
Very rare to find this combination.
So depending on the trial you're looking at, and there's some important work being done in Europe, and there's a few papers that are done in the US focusing particularly on this issue you mentioned. And looking at if you to apply inclusion criteria in any randomized trial, regardless of a device, you will only be able to enroll 5 to 7% of the patient population that we treat. And I feel strongly that bringing this front and center to a lot of our peers and a lot of our colleagues, making them understand that there is limitations in what we're able to do to these patients. But we're always focusing on the negative, and we're forgetting the positive impact we're making in the lives of a lot of these patients.
Yeah. So you keep pushing.
Correct.
Keep doing it.
Correct.
And you show the safe way, how to do it safely and have good outcome and change the patient outcome.
Correct.
Yeah.
Yes, absolutely.
Well, Dr. Saab, thanks so much for your time, and really enjoy your time. I enjoy talking to you at NCVH. Please watch these videos and others on NCVH YouTube channel. This is Chadi Alraies from New Orleans. Thank you, Dr. Saab.
Thank you.
Bye.
Azim.